Welcome, my name's Anthony Lucas, and today our topic is sleep and mental health. To tell us more, we're joined by registered psychologist and Sleep Health Foundation board member, Dr. Moira Junge. Dr. Moira Junge has over 25 years' experience in the healthcare sector and has worked in the sleep disorders field since 1994. Doctor, thank you so much for joining us today. Absolute pleasure to have you on. Well, let's get it started. What's the relationship between mental health and sleep?
Well, it's a big topic. I think it's a really important one too. And I think it's fair to say that there's a very strong relationship, very linear and bidirectional relationship between our mental health and our sleep.
Okay. So in terms of, being depressed, is it because we haven't slept well, or what kind of comes first?
Yeah, it's a really important question that when we're not sleeping well, it can absolutely impact on depression and anxiety, like make those things worse, or it was sometimes people's first ever episode actually of being depressed or anxious. But sometimes it can be the other way around, like that you have a depression or anxiety condition, and therefore as a function of that, or sort of a side effect if you like, or one of the symptoms is feeling like your sleep is disturbed. So that chicken and egg scenario has been around really only probably since the 90s that we've been talking about that in terms of the impacts of sleep on mental health. And it's a really important thing right now, particularly in Australia and all around the world, to be aware that because we do have a mental health crisis, like people are, we know that 20% of Australians just today will be having anxiety or depression, and across their lifetime, maybe half of them. So if we can actually think about the role of sleep in that, and if people are educated about that, then we know that we can actually improve the outcomes for the mental health issue as well. So when you're not sleeping well, let's go back to when you are sleeping well, you actually have the parts of your prefrontal cortex kind of soothing the parts in the amygdala in the brain, which is our emotional center. So it actually really, it actually can just make everything reset, like everything, calming down, like a soothing ointment.
Yeah.
But when the sleep isn't there, you don't
no way
get
to
that.
kind of support that.
That's right. And so people actually can feel very cranky, very, so obviously depression is the high end that you've been having a condition for some time, and there's lots of diagnostic criteria. But at the very least, people can actually just have a lot of difficulty regulating their mood. So it's a really important piece to talk about, this, I'm so glad we're talking about it today, because if we understand, because before, years and years ago, we thought that we didn't understand the role of sleep in mental health, and now we do. And so knowing that it's gold really, that we can, if people have got anxiety and depression, no matter which came first, if we actually just take out the piece of sleep and just actually educate people about sleep, let's work pretty hard on your sleep. Let's get you a couple more hours at least across the week, let alone maybe even 20 more minutes a night. There's really clear research that shows that does improve people's well-being.
So 20 minutes a night can actually improve your mental health because you're sleeping better.
Absolutely. So
I never thought of it like that.
So getting a little bit more sleep, or supplementing your sleep. If you had a shocking night, having a little bit of a nap here and there, like a short one, mind you, not sleeping away the day, but like a little power nap, 15 minutes. It really does, it obviously improves your alertness, but it can actually just take the edge off the crankiness, and it can actually just help soothe everything out internally. And you've got that if you can actually regulate your mood better, and if you can actually have ways of keeping your anxiety down, then...
So we kind of have to fix our sleep first in order to fix our mental health and our overall mood first.
Well, that's the beauty of all this, that it can be like this, back to the chicken and egg scenario. You can actually work at it both ways. If obviously when the depression, anxiety gets better, the sleep problems can go away. So it's an important part of all of us, like all the different people that work or are placing themselves in the mental health space, to Sometimes it's just a simple, just being aware of thinking, oh, I might actually ask about sleep. I'm going to bring sleep back into the equation.
Yeah.
And to ask about people's sleep, because you could be going very hard with some kind of other things, like, you know, we're much more aware perhaps of physical exercise, and much more aware of maybe getting people to eat better, or they might be on some kind of medication
to fix their depression.
To fix their depression. And there's
of course.
So, but in that picture, if the sleep is not there, if there's discussion about sleep and the education about sleep, if it's not there, then we're doing people a disservice. I suppose the main take-home message really is that both are important. And in fact, all three. If we think about anxiety, depression, insomnia, thinking about all like a triangle with double arrows between them, that we need to address and give all of them the importance that they need.
Would you say that, like, what can be done to improve our sleep and our mental health in Australia? Would you say there?
Yeah, well, that's bringing all the people together, the people that say the mental health field, the sleep field, the medical field, making sure that all fields that are turning their attention to mental health, and actually not only within that, like realising the importance that sleep can play in that clinical or in the workplace scenario, no matter where it is, in families, for instance, having an understanding of the importance of sleep and knowing that good sleep can not only improve your anxiety and depression, but sometimes it can be the other way around, that when you have poor sleep, it can be your first ever episode of anxiety or depression. So it's just a very, very important part of the piece. And so education is really important.
Yeah.
And having common goals is really important.
I've never really thought of it that way. You know, that sleep is that, to that extent, sleep is that important. To benefit your mental health. It's over-exercise even.
Yeah,
you know what I mean?
Well, exactly, because I think you're probably more aware of, like, say, going for a run, the feel-good hormones that you get if you do a workout.
Yeah.
And I think that we just need to be much more, give that respect to sleep as well, that it's a really important part of the piece to actually just improve people's well-being.
Absolutely. Well, thanks so much for joining us again, Dr. Moira. We hope you gained some insight into our topic today. If you'd like to find out more on today's topic, you can head to the Sleep Foundation website, sleephealthfoundation.org.au. I'm Anthony Lucas. Take care and stay healthy.